Welcome, everyone. Thank you for joining us today. My name is Dr. Louise Ivers. I'm the director of the Harvard Global Health Institute, and I'm delighted to welcome you to HGHI's virtual series called Coffee Sessions. This series is designed to explore and discuss the role of partnership and collaboration when working to advance global health equity. And you're welcome to join us on the last Friday of every month. We're taking a break for August, but we'll be back in September. But today I'm really delighted to be joined by two really wonderful people and great colleagues, Jessica Haberer and Jaap Boum, who are going to be talking about a partnership for a shared vision of equity in global health. A few notes. The session's being recorded through Zoom, and the recording will be made available on our website at HGHI and our YouTube page in the coming days. And we will have time at the end of the session for your questions. So if you have a question, you can submit it through the Q&A feature at the bottom of your screen, and we'll do our best to get to it. So with that, allow me please to introduce our speakers. Professor Jaap Boum is the executive director of the Institute Pasteur of Bangui in the Central African Republic. Prior to this, Jaap worked as a regional representative for Epicent in Africa. He has implemented research projects, including clinical trials on tuberculosis, malaria, Ebola, and COVID-19 in several regions, including in Uganda, Guinea, DRC, and Cameroon. He was involved in Cameroon's COVID-19 response as the Chief of Operations of Public Health Emergency Operating Center and has served on the international editorial board of the Lancet Global Health. He's a professor in the Faculty of Medicine at Mbarara University of Science and Technology, and he has published more than 100 research papers. Jaap has co-founded several nonprofits and platforms, including CamerPad, a nonprofit that develops washable sanitary pads for women, iDocta, a digital platform that brings healthcare services to the community, Homegrown Solutions for Health, an organization with a focus on homegrown and innovative solutions for Africa's social and health challenges. And if that didn't keep him busy enough, most recently, The Village, a digital platform that aims to decolonize global health by increasing access to resources. Professor Jessica Haberer is a medical doctor and a professor of medicine at Harvard Medical School. She's the director of research at the Massachusetts General Hospital's Center for Global Health, where we work together. Her research primarily focuses on the prevention and treatment of HIV and tuberculosis and involves diverse methodologic approaches and disciplines that include clinical epidemiology, behavioral science, implementation science, data science, mHealth, and modeling. She has collaborations with partners in Uganda, Kenya, and South Africa. Dr. Haberer is also committed to active mentorship, promotion of diversity in the workforce, and equity in global health research partnerships. She is the co-founder, alongside Jaap, of Homegrown Solutions for Health and The Village. So with that, it's my honor to turn it over to Jessica and Jaap to take it away. Thank you both.
Thank you very much, Louise, for giving us that opportunity to talk about partnership, to talk about all the journey, which has not been a smooth one since we met together with Jessica a while ago. I think it was in 2017 or something. That was the time, as you mentioned, I used to work for Epicent, which is the research arm of MSF, Doctor Without Borders. And at the time, I was working already with David Banksburg, who was leading the program in Uganda, which a huge study on HIV, UARTO. And I got that interaction together with Jessica, who was kind enough at the time to work with me on mentoring some of our junior scientists and researchers from Mbarara University and for Epicent. And since then, we've created that relationship that bring together the mentor part, but also the scientific part, because she was the one who took over from the UARTO as the PI. So we had that interaction, and as you were reading our bio, I could see if needed how much we are connected on our vision on bringing more diversity and more equity in research and capacity building. And through the challenge that we face in Barara, and through the difficulty on one mentoring our youngest, but also highlighting how challenging bringing equity was, we together write some few papers. One is advancing global health equity, which actually describe the situation we were in, and coming out with some proposal of how we can move forward on bringing more equity in terms of mentorship, also in terms of access to funding, to publication, and ensuring that both the global North scientists and the global South scientists feel that they own the project that they were in. And in 2018, 2019, she was kind enough to work with me and some very young scientists, most of them from different countries in Africa, to work on a systematic review, trying to assess the contribution of African scientists in research done in Africa. And then the title is Who's Telling the Story? So the question we were asking to ourselves, to Jessica and I, and Iroka and many others, was where are the African researchers in terms of positioning? Are they in first position? Are they in the last position? But also, what is the proportion of those one in research done in Africa on disease like Ebola, malaria, HIV, TB, and so on? And the result were saying that less than 3 or 4 out of 10 article will have either an African first or last author. And in some papers, there were actually no African. And then you can ask yourself, how can this happen? And the other thing that we found out, and which strengthened our partnership, is that only 10% of the funding were actually coming from Africa. So when we discuss through our relationship on how we can break those barriers and bring more equity, the issue of funding also came out in many of our discussion, leading to some other publication, but also pushing to how we can have some homegrown solution. That way come the name of our organization. How can we find those solutions, but also those local contributors who can fund the research, the project that we are in? So that way we actually started a while ago, and I'm happy to let Jessica carry on with her part of the start, and then maybe some other things. Jessica.
Yeah, thanks. Yeah. I mean, I think you laid out the roadmap quite well. And perhaps for this kind of discussion, where I think some of the interest is in how all this came about. It might be worth us talking a little bit about the transition from just working kind of around each other to really working with each other. And as you mentioned, we started off with, I think, a very traditional research, research partnership, in the sense that you were working with us on UARTO. And as you mentioned, I was working on it initially with David, and then took over as PI. And we had the interactions with our mentees. Some were easy, some were not.
Oh, why not?
As you know. But I think that opportunity, of being engaged with each other led to a lot of really important conversations. And I remember specifically, I think, a turning point in our relationship from just being research colleagues to starting to think about what could we really do about what had, I think, become clear as common goals and interests around equity and partnerships, and really what we're doing in global health. Was that that time when you were in Boston, and we were driving to the Center for Global Health, and we were talking about these issues. And I think, I can't remember exactly how it came about, but we decided at that point to write a paper. And I think the paper is the starting point. And that was that paper that you mentioned, the Advancing Global Health Equity paper, where we started to talk about the mechanisms through which we might be able to do more around what we were talking about in our conversations, but try to bring it to a wider audience. And the conversation around equity and partnerships and mentoring is something that people talk about all the time now. And I think it's not like we were the first people to do this, but I think at the time, this is many years ago, it took a lot of introspection, I think, on my part, and I think through our conversations, I certainly learned a lot, in how you see these sorts of things and how others might perceive them as well, and that led to a couple of papers. And then I think another transition point came later on, where we talked about papers as being a great first step, but you can publish a lot of papers and nothing changes. There has to be that next step to the action. And I think another critical conversation, and these conversations, I think, are really the turning points in the partnerships that we have. Just doing things like this on Zoom are great, but to have really in-depth conversations where we just talk about why we care, why are we doing this work? Why do we make the choices we do professionally and personally to pursue this kind of work? And out of those conversations come the next product or the next step, and really understanding where each other is coming from. And that next conversation was when we both happened to be in Haberer a couple of years ago, not really planned, but we had a really in-depth conversation about these issues. And it led to the village, and to the homegrown solutions for health, and trying to take our ideas from writing papers to a project that could really make a difference and try to have the impact that we're really looking for. And not to minimize the academic discourse. I think that's a critical first step. But how do we take it out of academia? How do we take it out of discussion? How do we take it into something tangible? And I know from my perspective, I like to be very practical, very action oriented. And I think that really led to the next phase of our partnership, where we've been working much more closely together in the last couple of years on the village, and trying to make opportunities that are scalable, that could have a legacy impact, as we've both grown a little bit older over the years, and trying to think about what our experiences together and separately, can bring to this discussion, and really trying to have a lasting impact beyond just the discussion. So let me stop there, and maybe you can add your reflections on the process, or jump into the village as you like.
Yes. So the way we can tell this story may look as if it has been smooth, which is definitely
un fleuve tranquille, no?
a long fleuve tranquille. No, it hasn't, but it has been a great journey. And as you mentioned, it has been a lot of opportunity of introspection. So as two people coming from two very different background and culture and language and all what we can imagine. So I think something that has been very helpful is that we have a common understanding of where we want to go. Not always sharing the same way of getting there, but at least we each of us know that we want to go there. And one thing that is the most critical in the partnership and in the equity is the communication. And the communication that we are managing, I don't say we have managed, because every day comes with its own surprise. It's to ensure that we try to put ourselves in the feet of the other. And when we do have misunderstanding, which happen, as even yesterday when we talk on WhatsApp, which is definitely not the good platform to communicate, because you don't have the emotion and so on. We always try to be as transparent, even and especially when we disagree, and that allow us to strengthen our trust, our confidence on each other. And that's a pyramid that we built with some colleague, which is the 4C pyramid for efficient collaboration. And the baseline of the pyramid is trust, confiance in French. So because we trust each other, that allows us to have a clear and very transparent communication. And it's only because we communicate in a very transparent way that we can understand. We may disagree, that's fine, but at least we understand where each other is coming from. And the last bit is collaboration. And that has allowed us through time to collaborate in a very efficient way by understanding that this point of time, I'm here, I'm not 100%, I need to communicate. And I thank you, Jessica, I've learned more how to communicate, especially when I cannot deliver or when I'm absent. Because sometimes we believe that because we are busy, though we are all busy, the other person will know that we are, which is not not true. So by just ensuring to say, okay, this very time is a bit critical for me, can you move our project, can we move our idea together, so that when I come back, I can take it from there and also give you some space. I think that has been very useful for all the time that we spent together, and allow us to move, as you rightly mentioned, to actually move out from science. Because most of the projects that we are talking about now, though we will be talking about other projects on HIV, My Way, and so on, it's how we can actually bring our contribution to equity, because that's something that is common. It's a common goal for all of us. And even if it's not a funded project as per now, even if it's not our main activity, it's something that we definitely give time together, which allow me, when I talk to you, to ensure that I deliver. And that's something quite critical, to have that transparent feedback.
Yeah, I mean, I think you really hit one of the key points to our partnership together is around communication. And people talk about communication, and we even included that in one of our early papers. But it's actually really hard, I mean, for anybody to communicate. But when we're talking about such different backgrounds and perspectives and language and just styles of communication and prioritization, as you said, we're both very busy people, but being able to understand how do we still accomplish what we want to do together. And I think that foundation of trust is absolutely critical, because even if you do have different ideas or different priorities at the moment, if you trust each other, you know you'll get there, and you know that the intention is aligned. And I think with that base, as you said, to the pyramid, you know, anything is possible. So I think that would be one of my main take-home points for anybody who's looking to build partnerships. There's, I think, a certain depth to that very simple statement that you can only really appreciate when you're trying to make major changes. And you know, that even a research project, I think, is a little bit more straightforward, because you have protocols and SOPs and you have your regular meetings. But I think what we've been trying to do in the last couple of years is really create. And that's a whole nother ballgame. And I think it's really exciting. And I love the work that we do together, but it is the communication, I think, has been the hardest part.
Definitely. And as you mentioned, those discussion, we have been having the chance to communicate our frustration. And one of those were, how can we scale the mentorship program that we were having? I think I don't recall how many mentees that you used to have in Uganda and Kenya and other places, myself as well. And I learned that term, serendipity.
Yes, serendipity.
Serendipity. And then we were wondering, how can people out of our network could benefit to that kind of mentorship? Which means, if you don't know Jessica, if you don't know Yap, but you want to benefit from what we want to give, how can this happen? And that's how the discussion around the village came out. As you rightly mentioned, the time we said, okay, why don't we actually do something more practical and scale to ensure that people who are not within our network can still have the opportunity, regardless of where they're coming from, regardless of their language, regardless of their disabilities. How can they access mentors? How can they have access to resource? And knowing the constraint that it may bring to actually being in a position to look for mentors and mentees, we decide to say, how can we rely on AI, artificial intelligence, so that they can do the match? And I recall when you mentioned, how about the village asking the question, what is your dream? And I said, this is the exact question that we want to ask to everyone. What is your dream? My dream is to be here in Bangui, for example, and have access to resource, have access to students in Boston, in Yaoundé, in Garoua, wherever, without knowing them. How can this work? And we say, okay, if you answer to that question to the village, then the village should be in the position to figure out, to match the mentors and the mentees, to break those barriers so that what we were doing at our small scale can be done at, let's say, at the global level, starting with global health because that's what we are in, but really at the global level. And then since then, we were fortunate to have some support from Jessica and some of your grants to allow us to have the first event. I think it was in Boston in 2022 now.
Yes, in December 2022.
December, it was cold, and then we were in that nice building.
It wasn't that cold.
Depending, everything is relative.
Yes, yes.
So, and then we had that nice event. We follow with a lot of people in the room, but also people from out. And since then, we've been able to bring some people on board to create that village. And maybe I will also let you, Jessica, to add on and share your perspective on where we are, and more especially how this can be moved forward.
Yeah, I mean, just to be clear for people who don't know what the village is, it's essentially LinkedIn meets Tinder, which usually gets a few giggles when we talk about that at meetings. As it's not really to encourage dating, but it's to use that same idea of making matches based on a full profile. And what we're trying to do is create those opportunities for people to follow their dreams, to be whoever they want to be. And the word that Yap brought up of serendipity is something that I've thought a lot about over my career, and thinking about how many key moments have happened that enabled me to become who I am today, and how those would never have been possible without the mentorship, without the opportunities. And people used to, well, I'll say myself, but a lot of people, including myself, would talk about, oh, that was a serendipitous moment when those things just happened to come together. And it's so clear that they didn't just happen to come together. I mean, sure, there's a certain element of luck, but there's a lot of preparation that goes into those moments of luck. And that opportunity is very poorly distributed across the globe. And so what we're trying to do with the village is equalize that and give everybody the opportunity through AI, as Yap was mentioning, and using the power of the internet. And it's been a really exciting process to try and go from a great event to kind of launch it, which it was, to the hard work of really making that happen, of finding the engineers, finding the designers that make the user interface interesting and appealing, thinking about ways to bring people to the site on a regular basis, because a single moment in time to make a match is not sufficient. And we've added on to the concept, and balancing the bells and whistles that bring people in with the core components, and how do we develop that, and just the nuts and bolts of really making this social enterprise happen is been very challenging, but also quite rewarding. And one of the ways we've balanced that is to also develop spaces on the Village platform. And this is still a work in progress. I see it's appearing in the chat now, so please do feel free to check it out. It's not fully functional, but what we're hoping to do in the coming months is give people the opportunity to share and to create their own moments and opportunities for that serendipity, not just through mentorship, although that is really the core of what we're developing, but also to share their science, to share their vision, to share their questions in whatever way makes sense for them, and to not necessarily use a Western lens, because that's obviously so pervasive in global health. So, not everybody has to write a paper that is to the standards of the Lancet, or something that requires even English. They should be able to, publish or describe or create a video or whatever resonates with their way of sharing what they're doing. And so we're hoping to leverage AI to make that happen. So the platform will be richer than just matches. But we're, in that process of trying to figure out how to make all those nuts and bolts come together. And I know we only have a couple more minutes. So I think one other thing I wanted to share, and Yap, I'd love to hear how you think about this. I know we talked about it a little bit the other day, but in doing all of this, it actually creates a fair amount of vulnerability in terms of what we're doing, like where we're placing our stake in the sand, so to speak, in terms of moving the field forward. Because there are a lot of people working on equity. There are a lot of people working on the field of global health, which is problematic. I think we all understand that. And knowing what is the quote unquote right thing to do, where are the priorities in the field, there's a certain vulnerability of putting yourself out there and saying, I'm going to do this because I believe in this. But knowing that may or may not work. And for me, like the anchor, I guess, in the work that we do goes back to that trust and I think our shared vision of where we're trying to go. And who knows if it's the right thing, but it feels right. It feels like we're going in the right direction. How exactly that path is going to flow, I don't know. But I think it inspires me, to continue to try and make it happen. And to go back to our earlier conversations, 10 years ago, where we started to think about how can we scale the individual impact that we're trying to have in a way that really makes a big difference. So I'll turn it back to you.
Yes, thank you. Equity, I was trying to see how many people are on the meeting. I think if we ask to the 150 people what equity means, we might end with 150 different understanding of what equity is. So what we do and what we will keep on doing is to also challenge each other and to ensure that we have a common vision of equity, because then we will manage to have, Jessica is not representing all the global north, I'm not representing all the global south, but at least having this very transparent relationship where we can talk about difficult things, but about also the challenge and the loneliness of pushing the equity barrier. It's hard. It's important to mention that pushing the equity, it's also something which is about privilege. And some of the people holding privilege, it's difficult to release some of them. So to manage that, we need to build the community, the village, beyond the matching and the mentoring, but really build the community of people in one side and the other are willing to see how we can have a more equitable community and global health. So I think that's the promise for many more years of relationship and partnership, which will at some point bring us back to research, to science, on the work that you are doing on HIV, which will definitely be able to benefit to the work I'm doing in Central African Republic. Some of the people you've already met, the Ministry of Health of the country, and others, people you are being introduced. I think the two things, one, the equity, but also the research, which also is an opportunity to implement what we believe will allow us to reach a good number of people who are in need, but also with time, I believe that the mindset, the paradigm will change, and we'll be happy to see the change. So I think now we are happy to take some of the question. I see that we are reaching that.
I will just make one more quick comment, if I may, and then Louise will turn it over to you. The last part that I want to make sure that we also touch on is the advocacy element to the work we've been doing together. Because we had webinar series. We meant to have it in person, but it was, I think, March of 2020 when we were planning to start, which was not a great time to get together in person. But we had a series of webinars where we tried to think through actionable items, not just like with the village and some of the other things we've been talking about, but getting people's input from a variety of perspectives, primarily based in Africa. And there were a lot of initiatives that came out of those discussions around things like the village, some of the mentor training that I've been doing, but also us thinking about funding and trying to use academic discourse to kind of advocate for things like changes in indirect policies, which we published on in the New England Journal a couple of years ago now. But also thinking about bringing people together for new paradigms on how we structure the institutions that are involved in global health. We have a Radcliffe seminar that we're going to be hosting in the spring to try and further those kinds of issues. So I want to get to the questions, so I won't go into that in any detail. But just to round out, I think the work that we're doing together, it really stems from individual relationships to these broader scale issues that I think we've been discussing for so long and working towards over the last decade or so. And I agree that the work we do together is really grounded in a shared vision, effort around the communication to make sure that we can act. So we'll turn it over.
Wow, thank you both. This is so great. I've really enjoyed being kind of a observer of this conversation between both of you and learning more about it, because we haven't ever really spent much time, even though I know both of you, talking about this aspect. And so I think it's so interesting, and many of the things you've talked about have come up in other conversations that we've had in this series. I have a few questions for you, and some are coming from the audience too. So one is about, and you talked about how you got started, but do you maybe have advice for more junior people as they get started in their global health partnerships? Because what always strikes me, or what strikes me about folks we've had on the session, is that, yeah, we're talking about long-term partnerships. You're talking about a decade. You're talking about relationships that are not transactional. They maybe they started on a project, but they've built. So how in 2024 do you advise your mentees or the folks in the village about getting that started and beginning the foundation of that trust that takes time to build? Do you have advice for people that you usually give, or can you give some?
Yeah, do you want to go first?
Yes, I was actually trying to get some okay. So I think a few years ago, with some folks from Yale University, we designed what we call the Douala Equity Checklist. I sent it on the chat so that it can be shared to many people. And it came out from our experience that we did have with Jessica, but also mainly from Sunil Parikh, who is working at Yale. And asking the question that you just mentioned, Louise, what are the questions that you need to ask to yourself at the time when you are designing the project, at the time when you are implementing the project, and after the implementation? So it's like the 20 questions that you can ask to you and to the partners, so that it's not a perfect checklist, definitely, but at least come out from the challenge that we face. It will be as simple as, okay, in our budget, we plan to send a student from Harvard to Uganda. That's where we have been working. But have we also considered some fund in our budget to have a student from Uganda to come to Harvard, where he or she can have access to some other education? That is at the time when we are preparing the budget, which is at the time of the design. But also at the time of, let's say we do have some great results, how are we going to ensure that those results will benefit from the scientific communities, which means published in Gold Journal, Lancet, and so on? So we have the provision, financial provision for those. But how also are we going to ensure that the stakeholders in the country will get the information, which means going in newspaper, which might also have some cost. So that has to be part of the budget, and that has to be taught. So those are some few examples of some very simple things that need to be taught at the time we are planning the project. And going through the checklist is a helpful way to not to ensure that we do the right thing, but at least that we are in the good direction. Jessica?
And yeah, just to add a little bit, I've maybe have a different element to that, because I think the Douala checklist is an absolutely fantastic resource. But going back to what I was saying before, I think the way we got started with some of the work that I feel is the most meaningful has been out of conversations. And that sounds so simple, but so much of what we do is transactional, like you said, Louise. It's what is the project, what is the paper, what is the, the X, Y, or Z. But even in the last couple of days, I've been chatting with a number of people at NIH. I've been speaking to someone from Congress, other people where we don't necessarily have an agenda, but we have a shared vision of something we'd like to see happen. And especially in the Zoom era, that can be hard to do. It's hard to say, like, let's get on Zoom and have this really deep, meaningful connection, especially when you don't really know each other. I mean, maybe we could do that now, but I think, making the space to listen, to share, to have those moments of professional or personal vulnerability, which I don't think is always very, well, I'll speak for myself. It's not always comfortable. But that's where I think the magic starts to happen and the inspiration starts to happen. And you can, I think, find those dreams that we're hoping people will be able to connect around on the village, but to do that on a one-on-one basis. And for junior people, you may not have $1 million to offer, or you may not have that experience you need to do the work you want to do, but you have your ideas and you have your passions, and reaching out to senior folks, reaching out to colleagues, and really just, exploring what you feel passionate about, I think is a great way to get started.
Thanks for that. And James in the audience was asking about the consortium of universities in global health, CUGH. They have recently come out with recommendations, and one of our colleagues at Harvard, I know, is part of that. And you mentioned the checklist, and I know there's other checklists. Do you have specific thoughts, either of you, on the CUGH recommendations, if you're familiar with them? Or in some ways, is it just important to do something, have a checklist or someone's checklist or your own checklist, but that you're thinking together on this shared future with your partners that you work on? But any specific comments on CUGH?
I'll start just briefly. I think CUGH is fantastic. It's a great organization. It's a great way to network. And I think there are a lot of like-minded people when it comes to issues around equity. I don't know that if it's so important to use that checklist or another checklist, as you said. I think it's really the principles. And I think just being very intentional about how you apply those principles to the specific partnership that you're in. We throw around words like equity and privilege and all these terms, and sometimes it's easy to forget the true meaning behind it and how you apply that to the exact relationships that you're in. So I think for me, that's the much more important element to it. Yeah, what do you think?
No, definitely. And I believe that what we are doing, we are creating a critical mass of people or consortium would think alike. And I think that at this time is the most important. The tool will definitely will be able to adjust, and one day we'll have maybe one. But as you mentioned, what is the most important now is to have a couple of people, a couple of institutions who really want to act and who commit, actually, when they talk about equity, where we can see that, okay, they commit on having, let me bring my language issue before we end, to ensure that we have our paper published in different languages so that every scientist can have access. By the time universities commit to that, I'm talking to CUGH, but I also extending to editor, to publisher, to ensure that they play the role and they do what they say they will do. I think that's the most important now, and I'm very happy. We are happy to see that there's a lot of progress on that line.
Yeah, thanks. So I'm going to squeeze in two more questions before we turn it back to your final reflections. One is, I think they're related. One is about how to influence policymakers, but also funders. And one attendee is specifically talking about the disparity in NIH budgets related to salaries for US investigators versus Global South investigators. How do we, Jessica, you mentioned advocacy as part of the work, but do you think there are specific things we should be doing, or is it this critical mass that will help change? Any specific comment on the funders and especially the NIH, I would say?
Maybe I will start from the Global South perspective. I think the most important thing is, who are the policymakers? This is the first question that we should ask. Are these the Minister of Health, or the community leaders, or the community representative? Once we agree that whatever we are doing, it's for the community, we will ensure that in the way we plan the project, in the way we implement, in the way we disseminate, the community and their leaders are always part of it. So which means that when we have the finding, let me start by the end, the finding of our research, we have some important result, we should always find a way so that the end user get the feedback. And I recall that big and very nice party that we had during Yoato in Uganda. And then we were having the participants, there were, I think, 1,000 of them. They were doing the games, and they were giving back the message of the study by themselves. And I found it so powerful, because that's when you have the feeling that you've done something for the community and they feel like they've been part of all of it.
Yeah, and I think from my perspective, institutional change is sometimes seen as like this holy grail, that it's almost impossible to find, the right solutions. But we can chip away at the problems in whatever sphere we have some influence in. And as you're a junior, that may not be a whole lot, but you can write papers, you can have conversations, you can go to events and start to contribute to larger bodies like CUGH or others. And I think there is a lot of potential in numbers and being able to have like regional agendas if you're maybe working in different parts of the world. Doesn't have to be CUGH. But I think also for those of us who have been able to have some leadership positions, especially over the years, being invited to meetings at NIH in particular, on study section where we review grants, I'm always bringing up these issues, of these disparities, and I'm starting to see, some little changes. And by no means am I the only one doing this, but I think all, as everybody can contribute in small ways, eventually, we have the larger impact. So it can be a very multi-pronged approach. We can find workarounds. Like I'm working with some groups that are able to bump up that indirect cost rate that we're trying to advocate for at the national level, as an example of how it can be done. So we can go back to other people and say, this will work. And then the process is to figure out how to make that happen. So I think in a short, a short way, just doing what you can when you can, but remembering to think big and figure out what we can do together.
Oh, that's great. We have 1 minute left, so I'm gonna give it to Yap for a closing thought. Anything that you feel like you wanted to say, you didn't get to say, or people want to know more about the village. If you have something to tell us about how we can get involved, over to you, Yap.
Thank you. So to close, and I will invite everyone to join the village. I think the link is in the chat. And most important, everyone has something to give. Whatever it is, however small you think it could be, it can make a huge impact on the people who are in the receiving end. So I thank Louise and Jessica. I think we have many more years for partnership. And I'll be privileged and happy to work with you, and I believe that we'll keep on doing that.
Thank you both so much. This has been really great. Thanks to our audience members. Just mark your calendars for September 27th, which is our next session in this series. Have a wonderful rest of the day and enjoy the Olympics. Yeah.
Thank you. Bye-bye.
Bye-bye. Thanks, everyone.